Great. Thanks so much, Chris. I don't know if I'm projecting. Before I screen share, so good afternoon, everyone. My name's Tammy. As Chris said, I work for WRHI. I just wanted to take this opportunity to really thank PATHSA for inviting us to this training and giving us the opportunity to share with everyone what's been happening in our program over the last 2 years. So let me screen share now. Right. If someone can just give me an idea that it's coming through.
Fine.
Great, super. Thanks, everyone. Okay, so just an overview of what I'm going to be speaking about today. So just a brief history of the WRHI Key Populations Program, our implementation model, demand creation and community mobilization, data analytics, and some lessons learned. So very briefly, our story. So in 2005, we pioneered the first sex worker STI clinic. In 2012, we had a sex worker and male clients program. In 2015, peer educator outreach program. And the good news, in 2018, we were awarded a 5-year US aid grant for advancing the South African HIV response for key populations. And that's enabled us to now provide services to the transgender community. And from 2019, we now have 4 transgender sites across South Africa, providing primary healthcare services, including hormone replacement therapy. So if you just have a quick look at the picture up top, that's in fact our Braamfontein Trans Health Centre in Johannesburg. And the picture at the bottom is just one of the clinical rooms at one of our sites. So where are our sites? We have one in Johannesburg, one in East London, one in Port Elizabeth, and one in Cape Town. And the aim for us is to deliver accessible and quality HIV prevention and treatment services to key populations in South Africa. So what are our program objectives? And these were actually set out by our funders, USAID. So the first is HIV prevention, care, and treatment services. And this is really speaking to the global 95, 95, 95 targets, and Dr. Zama had gone through them in her talk, so I won't go through it again, but that's what that's about. So the second one is increased capacity of civil society, and that's really about community involvement, empowerment of the transgender community, gender sensitization, education, and outreach. And then the third is planning, monitoring, and quality assurance. And that's really important for us as a program, that we gather data to actually understand how the program is performing, because this then enables us to monitor it and use adaptive management. So change and tweak things according to what the data is telling us. So let's look at trans health and service provision. So as you've heard before, transgender women are disproportionately burdened by HIV infection, with a prevalence of around about 46% in South Africa. Transgender women in sub-Saharan Africa are twice as likely to have HIV as men who have sex with men. And Muller et al. Last year did a study, and they found 73% of transgender and gender non-conforming people accessing healthcare in South Africa have been treated with less respect because of their gender identity. 48% have been insulted in health facilities, and 40%, unfortunately, have been denied healthcare. So the picture does look grim, but there has been great news. So in December 2019, we had a breakthrough and a milestone. And what that was about was when the National Department of Health included hormone therapy for gender affirmation on the essential medicines list. So what that means for individuals is that they now can access hormone replacement therapy at or within the Department of Health cascade of services. So if we look at our health model of care, we like to sort of view it as an ecosystem. So a integrated model of care, which we feel will lead to better health outcomes. So it really essentially consists of 4 areas or pillars. So the first is the psychosocial support, so around mental health counseling, peer-led groups, gender-affirming care sensitization training, interpersonal and gender-based violence, and all the social work services and interagency referrals. We then have our HIV services. So that's about testing, self-screening, same-day antiretroviral initiation, pre-exposure prophylaxis. We have our primary healthcare area, so antiretroviral therapy, treatment of any opportunistic infections, and ongoing adherence and family counseling support and administration. And then we get to the last area, which we feel is absolutely essential if you're going to provide an integrated model of care, and that's gender-affirming healthcare for trans individuals, which includes hormone therapy. So, you know, HRT is a life-saving intervention, and in some cases, the desire to access HRT can be someone's primary reason for accessing a healthcare service. So it is absolutely essential that this type of service is part of the integrated model. So how do we implement our model? Well, we have 3 avenues. The first one is our static clinics, and that's Brahm again. The next one is we have mobiles, and just in the background, you can see a mobile van, and there's consultation rooms on the van and a full complement of staff. And then we also have community groups and peer-led outreach. And across all avenues, we have a comprehensive package of service. So demand creation is really important. We use TeleRivet, SMS platform, online outreach, respondent-driven recruitment, and that just means enhanced peer outreach approach, and micro-planning methods. And what that is about is having a single peer educator that has a group of clients that they follow and track and trace if need be. So community mobilization. So COVID has forced all of us to get creative. So the picture on the left is, it was an aerobics class done in one of our safe spaces, driven by the social worker during COVID. And then the picture at the bottom is a group of our community outreach peers, and they basically go door to door to reach and help our beneficiaries of the program. So in order for us to really expand our district coverage and increase uptake of services, we do need community collaboration and empowerment. And that's why the Community Advisory Board was established. It's currently, unfortunately, only in the Johannesburg area, but there are plans to extend that into the other provinces. And as you can see from the slide, we work with a number of community organizations. This is just a brief slide on our data analytics. So what we do is we use weekly and daily reports that get sent back to our technical side, and then that enables us to support sites in terms of performance and key indicators. So those are just screenshots of some of our reports. Okay, so this is a really interesting and important slide. This is actually our data from our program. So I'd like to start with the bar graph, and this is just really highlighting our progress in terms of the 95, 95, 95 strategy that I mentioned earlier. So if we start with the largest bar, so 3,868, so that's the total number of individuals who we have tested for HIV. 17% of them, so we're going right, 17% tested positive, so that's our yield. We've managed to link 88% of our individuals into care, and currently our viral load suppression rate is sitting at around about 84%. So if we go back to the middle, 3,200 and 17. So those were the individuals who tested HIV negative, and we have quite a high PrEP uptake at around about 28%. So moving to the right of the slide. So at intake, meaning it's the first visit or first contact with our service, so we haven't provided any services yet. Interestingly enough, 28% of individuals who came to our service who knew they were positive were not on antiretroviral therapy. And only 1.5% of patients had successfully accessed any gender-affirming healthcare. This slide was actually taken from our COVID-19 impact study, and it's looking at HRT initiations. So if we go from FY20 Q1 to FY20 Q4, this is pretty much during the entire COVID era, you will see an increase in demand for HRT initiations and an increased number of individuals initiated on HRT. So it's really interesting because, you know, despite the restriction of lockdown, we still saw an increase in demand for HRT. So the yellow line with that massive spike is from our Cape Town clinic. And what actually happened there was when they had an outbreak, all the tertiary hospitals closed their outpatient services. So individuals who were accessing hormones through these services were no longer able to, as all outpatient clinics were deemed as non-essential. So we were very fortunate enough that at a primary healthcare level, we could still maintain our full package of care. So that big spike is people transferring into our service in order for them to continue with their hormones. Another interesting fact, among our clients who are on hormones, 42% are HIV positive, and we have a 100% antiretroviral therapy coverage. So that's great. Program achievements, I'm not going to read the list, but just to highlight a few. So we really do have a comprehensive service. We're able to have a full multidisciplinary team. We also have collaborations with other organizations who refer individuals to our services provided with full informed consent, and we have a very client-centered approach. The last slide is our gap analysis and mitigation plans. I won't go through it like I did with the previous slide, but I just do want to take a minute just to discuss or highlight the medication stockout and consistent supply of HRT. It has been an ongoing challenge for us. We're very aware of it. So what we've actually had to do is start relationship building with other potential sources of HRT. So for example, our Johannesburg clinic normally gets from one hospital, and they have not been able to provide us the full quota that we need. So we've had to engage with other hospitals. Unfortunately, what we've also had to do is stagger the HRT initiations. It is not our preference, but we do have a responsibility to our clients who are already on HRT that we've initiated to ensure continuity of care. So just a final thank you. My email address is there, as well as Rutendo Bothmo, who's the Senior Advisor for Community Engagement. Please feel free to email either of us if you wish to continue the conversation or if there are any questions around our program. Thank you very much.
Thanks, Tammy, for that. It's absolutely so wonderful to hear what these clinics are doing and how it's grown from really getting going and then absolutely just bursting out of its sides this year. And thank you for that. It's really, I think, for all of us in this field to know there's places to refer people to. And hopefully one day we'll have you in KZN as well. We're still waiting for that.
We definitely want to be there. Thanks so much, Chris. Ciao.